Michael Mercado, and I'm going to present vital sign taking temperature, pulse, respiration, blood pressure. Definition: vital signs taking is a procedure that provides data that reflect the status of several body systems that includes cardiovascular, neurologic, peripheral vascular, and respiratory systems. The sign of basic physiology is reflected in a body temperature, pulse, respiration, and blood pressure. Measure temperature first followed by pulse, respiration, blood pressure, and oxygen saturation. The purpose: to assess the client condition, to determine the baseline values for future comparisons, and to detect changes and abnormalities in the condition of the heart. Then to take vital signs: first, upon admission as ordered; second, any change in status with chest pain or any abnormal sensation; third, before and after administration of pre-operative medication; fourth, after surgery or invasive diagnostic procedures; fifth, before and after administration of blood products or medications that cause cardiovascular and respiratory changes; and last, sixth, before and after any nursing intervention that can affect the cardiovascular or respiratory system. Process of measuring or monitoring the patient's body temperature using a clinical thermometer. It may be taken through the axilla or orally through the tympanic membrane. Normal axillary temperature range is 35.4 to 37 degrees Celsius, and the normal oral temperature is 35.9 to 37.5 degrees Celsius, and the normal tympanic temperature range is 36.7 to 38.3 degrees Celsius. Temperatures below 36.7 degrees Celsius represent hypothermia and can be a result of prolonged exposure and called hypoglycemia, hypothyroidism, starvation, neurologic dysfunctions, or shock. Temperatures above 38.3 degrees Celsius represent hyperthermia and can indicate bacterial, viral, or fungal infections, an inflammatory process, malignancies, chorioma, or various blood, endocrine, and immune system or immune disorders. The purpose: to determine body temperature, to assist in diagnosis, to evaluate patients' recovery from illness, and to determine if immediate measures should be implemented to reduce dangerously elevated body temperature or conserve body heat when body temperature is dangerously low. And last, to evaluate patients' response once heat-conserving or heat-reducing measures have been implemented. Temperature below 36.7 degrees centigrade or 98.0 degrees Fahrenheit represent hypothermia, or temperature above 38.3 degrees centigrade or 100.9 degrees Fahrenheit represent hyperthermia.
Assessment: assess client's skin if warm to touch. Assess for most appropriate site to check the temperature. Planning: wash hands and gather the equipment needed. Check the client's identification. Introduce self and explain procedure to the client. Close doors and use a screen. Take the thermometer and wipe it with cotton swab from bulb towards to the handle. Press the button that will erase the digital numeric display. Assist the client to a supine or sitting position. Move clothing away from shoulder and arm. Be sure the client's axilla is dry if it is moist, but drying gently before placing the thermometer. Place the bulb of thermometer in hollow of axilla at anterior inferior with 45 degree or horizontally. Keep the arm flexed across the chest, close to the side and the body. Remove the thermometer and record the temperature reflected in the digital display. Disinfect thermometer with cotton swab soaked with alcohol. Explain the result and instruct the patient if she has a fever or hyperthermia. Dispose the soil materials properly. Wash hands and return all materials to its proper place. Evaluation. Evaluate the temperature taken. Documentation. Record the temperature taken, affix signature on the chart. Report any abnormal readings to senior staff. Assessment. Assess the client's skin if warm to touch. Assess client mouth for oral lesions and sores. Planning. Wash hands and gather the equipment needed. Check the client's identification and explain the purpose and the procedure to the client. Close doors or use a screen. Take the thermometer and wipe it with a cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display. Assist the client to a supine or sitting position. Ask the patient to open his mouth or her mouth. Place the thermometer under the client's tongue to the right or left of the frenulum tip in the posterior sibling pocket. Move the thermometer. Disinfect with cotton swab soaked with alcohol from the handle towards the bulb. Explain the result and instruct the patient if she has a fever. Assessment. Assess the client's skin if warm to touch. Assess for most appropriate side to check the temperature, either left or right ear. Planning. Wash hands, gather equipment needed. Check the client's identification, explain the purpose and the procedure to the client, close doors and use a screen. Take the thermometer, wipe it with a cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display. Assess the client to a supine or sitting position. Ask the patient to expose his ear. Place the probe of the thermometer very gently at the opening of the air canal for 2 to 3 seconds. Hold the thermometer in place until you hear a beep sound. Remove thermometer and read the numeric display. Record and return all equipment to its proper place. Evaluation. Evaluate the temperature taken and documentation. Record the temperature and affix signature on the chart. Report an abnormal reading to the senior staff. Assessment. Assess the client's skin if warm to touch. Assess for most appropriate site to check the temperature and assess for any presence of lesions, sores in the anal region, and planning, wash hands and gather the equipment needed. Check the client's identification, explain the purpose and the procedure to the client. Close doors, use a screen. Take the thermometer and wipe it cotton swab from bulb towards the handle. Wear gloves, press the button that will erase the digital numeric display. Position a client to seam side lying position with the upper leg slightly flexed. Drape the client by exposing the anal area only. Lubricate thermometer bulb around 2.5 cm or 1 inch. With non-dominant hand, separate client's buttocks to expose anus. Gently insert the bulb into anus around 3.8. Leave the thermometer in place until it beeps. Remove the thermometer and wipe off any secretion for stem towards the bulb with a rotating motion using a cotton ball soaked with alcohol. Read thermometer, wipe client anal area with soft tissue, discard soiled articles, use wash hands. Evaluation. Evaluate temperature taken and documentation. Record the temperature and affix signature on the chart and report an abnormal reading to the senior staff. Assessment. Assess client condition and check the nature of pulse. Planning. Wash hands and assemble the equipment. Identify the client and explain procedure. Have the patient rest arms alongside of his body with the wrist extended and the palm of the hands downward. Place the tips of the middle three fingers of the palm side of patient wrist. Rest stamp on the back of the patient wrist. Apply enough pressure so that you can feel pulse. Using watch, with second hand, count the number of positions felt in the patient pulse for 1 full minute. If the pulse rate is abnormal, repeat the counting in order to accurately determine its rate, quality, and rhythm. Wash hands. Evaluation. Evaluate nature of pulse, documentation, record result of rhythm and force in patient chart. Respiration, the number of breath per minute, or more formally, the number of movements indicative of respiration and expiration per unit time. In the practice, the respiratory rate is usually determined by counting the number of times the chest rises or falls per minute. The aim of measuring respiratory rate is to determine whether the respiratory are normal, abnormally fast, abnormally low, or non-existent. Normal range below 6 months 30 to 60 bpm, 6 to 12 months 24 to 30 bpm, 5 years 20 to 30 bpm, 6 to 12 years old 12 to 20 bpm, and 12 years old to adult 12 to 20 bpm. The purpose: provide valuable information about the client's physical and emotional health. Assessment. Assess client condition and check nature of respiration. Planning. Wash hands. Identify client and explain procedure. Hold the client's wrist just as if you were taking her pulse. Note the rise and fall of the client's chest. Using watch with second hand. And last, wash hand. Evaluation. Evaluate the character of respiration and documentation. Record the character and the depth of the respiration. Blood pressure taking. Pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. Purpose: to determine vascular resistance to blood flow, to determine the effectiveness of cardiac muscle in pumping blood to everyone the vascular resistance. Materials: blood pressure apparatus, sphygmomanometer, stethoscope, paper and pen, cotton ball with soap with alcohol. Palpatory method: palpate brachial pulse distal to cuff with fingertips of the non-dominant hand. Close the screw clamp of the valve. Inflate the cuff while still checking the pulse with other hand. Observe the point where pulse is no longer palpable. Inflate cuff to pressure 22 to 30 mmHg above point and the which pulse disappears. Open the screw clamp, displate of the cuff fully and wait 30 seconds. Auscultation. Position the stethoscope earpieces comfortably in your ears. Place the diaphragm over the client brachial artery. Do not allow chest piece to cough or clotting. Close the screw clamp on the valve and inflate the cuff to a pressure 30 mmHg above the point where the pulse has disappeared. Open the clamp and allow the aneurodial to fall at rate 2 to 3 mmHg per second. Note the point and the dial when first sound is heard. The sound will slowly increase in intensity. Continue deflating the cuff and note the point where the sound disappears. Listen to 10 to 20 seconds after the last sound. Release remaining air quickly in the cuff and remove it. If you must recheck the reading for any allowed 1 minute interval before taking blood pressure. Evaluation. Evaluate the nature of the blood pressure. Evaluate the client condition and record the result taken with the documentation.
もしもし